Hi all, myself Beno Paul from SNS College of Physiotherapy. Today we can see about the sensory assessment. So which are the condition can must assess the sensation? So any sensory dysfunction due to the any pathological or any injury associated and affected the peripheral nerve injuries, and also any deficit occur at the any point of the sensory receptor or any peripheral nerves or any spinal cord nucleus or any tract. So main these receptor or any tracts carries the sensory, so only we can assess the sensation. And also in injuries in the peripheral nerves, so any damages or any metabolic disturbance in the nerve and any infection or any compression, burns and nutritional deficit, and also injury to the nerve roots, that CVA, cerebrovascular accident, or TIA, and any tumor present in the nerve root, and multiple sclerosis and any brain injuries. These are the conditions we can assess the sensation. So first we can, before the sensory assessment, we can prepare the patients. So before initiating the examination of the sensory function, to first testing the environment to identify and prepare, and needed the equipments gathering, and also patient preparation. So testing environment, so sensory examination should be associated or in the quiet, well lightening area. So depending upon the number of the body areas, to test it, either sitting or any other positions may be used. So equipment sensory examination, we used equipment like for sharp safety pins or blunted pins for assessing pain. And in the temperature we can use the test tubes, and for light touch we can use the soft hair brushes or pieces of cotton and tissues, and for vibration we can use the tuning fork. So first in patient preparation, we can first to explain about the assessment, fully explain about the examination to the patient. So first we can see about the superficial sensory examination. In superficial sensory examination we have four. So pain, light touch, temperature and pressure. So these four we can assess under the superficial sensory examination. So first we can assess the pain perception. So to test the pain awareness by the sharp or dull end of the large headed safety pin, or reshaped paper clip or neurological pin. So these are the materials we can use to assess the pain perception, and that instrument should be cleaned for before the testing. And also to avoid summation of the impulses, that to stimulate should not be able to close to each other. So response in pain perception examination, the patient to ask to verbally indicate sharp or dull when a stimulus is felt. So all areas should be tested. So these are the pin. So this is a dull object. Next, temperature awareness. So in temperature of awareness, to test determinants the ability to distinguish between warm and cold stimulation. So we can take a two test tube with the stopper or required for the examination. One test tube full with the cold water and another test tube full with the hot water. So we can, these test tubes alternately we can test with the area, with the patient to ask to reply this is a hot or this is a cold to after the each stimulation application. So these are the test tube. And touch awareness. So these tests determine the perception of the tactile touch input. So we can use the object like brush. soft hairbrush or piece of cotton or tissues. These material can to use for the assess the touch sensation. So patient to ask the indicate where he recognize these touch or yes or no. So that patient can recognize and feel the sensation of the touch to say yes or no. Next, last pressure perception. So pressure perception we can use a therapist fingertip or double tipped cotton swab to apply a firm pressure on the skin surfaces. So these pressures should be firm enough to indent the skin and to stimulate the deep receptors. So response from the patient to ask to indicate where the applied stimulation is recognized by responding yes or no. So next, so deep sensation, kinesthetic, proprioception and vibration. So in kinesthetic, so assess the awareness of the movement. So enter the extremity is moved passively through a related small range of motion. So therapist should explain, so and also demonstrate trial section also. So response like patient to ask describe verbally the direction and range of the motion in term previously discussed with the therapist while the extremity is in the movement. So second, proprioception. So this is a joint receptor or joint position sense we can assess through the extremity or joint is moved through the range of motion and held in the static position. So response in this assessment, so while the extremity or joint to held in a static position by therapist and the patient is asked to describe the position of the joint through the verbally. And last is vibration. So this vibration use the tuning fork, that's a 128 hertz. So we can closely to tap tuning fork and place in the bony prominence, and he felt that vibration in the which area. Thank you.